Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, in this episode, I sit down with Julia Robertson to dive into her fascinating journey into Galen Myotherapy. Now this is a specialized hands-on approach to canine rehab. Julia is passionate about patient choice and advocates for giving animals autonomy to guide their own treatments. She believes that when we respect an animal's preferences and responses, we create a more effective and compassionate healing experience. Now, Julia walks me through what a typical Galen Myotherapy consultation looks like, explaining how she assesses each patient, incorporates their feedback, and adjusts treatments accordingly. She also shares how her philosophy has evolved over the years, leading to the development of the positive PAC system, which is a structured approach to therapy that promotes positive interactions, trust building, and truly patient-led care. So whether you're a vet rehabber, a hydrotherapist, or just someone who is interested in a more ethical, patient-centered approach to treatment, you'll gain valuable insights from this conversation. If you're not a member already, our amazing online community of vet rehabbers from all over the world gathers in our Facebook groups. So if you haven't joined, please head over to Facebook and request to be a part of the action. Our groups include small animal vet rehabbers, equine vet rehabbers, hydro vet rehabbers, and business vet rehabbers. That's the one for those juggling patient care and running your own practices. Now, we regularly share tips, advice, we host live sessions with experts to support you on your vet rehab journey. A quick word from our sponsors before we dive in. At Paw Prosper, we believe true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Our brands are trusted by veterinarians, universities, and rehab facilities alike. So whether you're looking to train, rehabilitate, or help your patients age gracefully, our brands, Walking Pets, Help 'em Up, Response System, Fit Paws, Muffins Halo, Sleepy Pod, and Canine Carts offer effective, innovative, and proven solutions. You can sign up today to receive a one-time special gift for all the podcast listeners with your next order, and you can go to this link, pawprosper.com/OPH. Right, over to my chat with Julia. Hey Julia, thank you so much for coming on the show. I'm so excited to chat to you.
Oh, it's great that you've invited me. Thank you very much indeed. I'm really looking forward to this conversation too.
Before we get into all the nitty gritty, won't you just explain to the listeners about a little bit about yourself and how you got into Galen Myotherapy?
Yeah, sure. Love to. I'll try and keep it quite short because obviously our histories are quite long and protracted. But basically, it was a dog that got me here. And quite often, any story with people that find a mission and a purpose, it is driven, especially in the canine world, by a dog. And this dog happened to be called Huffo, and he was a beautiful 6-month-old Labrador. But this beautiful 6-month-old Labrador must have had an accident. And I say must have because friends were looking after him and they didn't know what happened. But basically, when we went away for a weekend, came back, and he couldn't lift his head from the ground. So he could walk and he was practically dragging his nose. So obviously we went to the vet and he was x-rayed, nothing. He had blood tests, nothing. Now this was back in the early 90s. So diagnostics and everything were very different then, and knowledge was very different. And we went to see a couple of vets and they had no idea why he was walking like that. And we got to the stage, and this is a couple of 3 weeks after the initial injury, and we were told that he had to be put to sleep because it must have been some degenerative disorder because they didn't know what it was and he wasn't improving. So I was sleeping downstairs with him and helping him up because, of course, he couldn't stand up, sit down, couldn't do anything particularly well. He could still eat, though. And that was the big thing. And I just thought, we can't have a 6-month-old puppy put to sleep. We just can't. But I didn't know what to do. And then I suddenly started to relate to my own physical problems. I've got a spondylosis. So I have to really look after my soft tissue connections and everything, even though then it wasn't as good as it is now. And I thought, well, what would I do if I couldn't do that? So I thought, well, maybe a little bit of very easy exercise, just trying to lift the head. And because he was still keen on food, I got a biscuit and just invited him to lift his head just a little bit, and it lifted. And then the next day, a little bit more and a little bit more. And he started to be able to hold his head in a higher position. And about a week or two later, he had his head in an almost natural position, which was amazing. And I thought then, my God, we nearly had him put to sleep. It was so close. And yes, he must have been in pain. Yes, he must have been in discomfort, but he did not want to die. And when I have a backache or a neck ache, it is, or pain, it is bad, but I don't want to die. And that's when I started to get nightmares about maybe other cases that didn't have a better outcome. But this dog lived till he was 17. So he really went out and said, I'm going to make the best of my life. I obviously learned since then that it's not just a one part of the body, his whole body needed treating. So he did have the most unusual gait, but he lived to 17. So that was when I decided that that's what I wanted to do. But this was years ago. This was, as I said, in the 90s. So, and it took me a while for my personal situation to change until I said, right, this is what I'm doing. But of course, there was no one doing it, anything like it in the UK. There weren't really any, well, there were no physios, no canine or small animal physios, but there were horse people. So I spoke to a horse physio and she suggested I did a horse course, which I did. I was studying the human side of it, so to try and get a rounded education. And then I traveled to the States to actually qualify in canine, and then came back and basically have put all the equine, human and canine together and started Galen. But that was in 2002. And so people are going, what are you doing? Hey, what do you do? What, massage for dogs? Come on. What, do you mean like a spa? No, like a real clinical type of treatment. And at first, because over here we have to get veterinary consent before we do any manipulation, which is great. And so I spoke to vets and they went, well, I suppose you can't do any harm. So I was getting a lot of sort of palliative care, end of life type of cases. And they were turning back the clock and they were making remarkable changes and their lives were improving. And it was just fantastic. And so I got busier and busier and busier, which was lovely, but realized that actually, if this was going to be a proper therapy, I needed other people with me to do it. And that's when I started the school and we got the accreditation. And since then, we've been training therapists and we have nearly 200 students now and 60 odd therapists that are registered with us. So it's fantastic. And that's sort of the potted history of it. And of course, now it's changed so much. There are so many therapists out there, which is fantastic.
And then the word Galen, where did that come from? So did that, is that something that you made up or something that you'd been exposed to, or?
Right. No, it was, well, I thought, how do I name something? And it's very difficult, isn't it? And I thought, well, either it's got to be what I do, about what I do, or some historical contact. And of course, Galen was a guy, a very cool man, way back in sort of Roman era. He was actually Greek, but he was called upon to do clinical stuff on soldiers and in that time of great sort of fights and things. But also he did a lot to discover about our circulation. But at that stage, no one could do any, what's the word? Cutting up, looking at, can't remember the word, a dissection. That's the word, difficult word, on humans. You could only do it on animals. So he did a lot of work on animals. So he discovered a lot about circulation on animals. And so I thought, well, you really did change things. So I grabbed his name, and hopefully if he knows about it or knew about it, then he'd be proud to know that he's representing the canine world.
Oh, that's lovely. I didn't know that. So then what is, you said Galen, is that how
Galen, you put that R in. Yeah, because
yeah.
it's the Greek name, yeah.
Okay. So what actually is it? Like if you could just summarize it.
Right. Okay. Well, it's basically hands-on, so it's massage. Okay. So we're absolutely hands-on, but we're also looking at the biomechanics, and we do the rehab. But it's a very full protocol. So we don't just meet a dog and start massaging. We do an initial visual assessment first. We do a postural assessment before we do anything. And of course, we incorporate choice, which I know we're going to be talking about, but we also give exercises and activity, and we advise on environment. And a lot of our things and our topics that we've talked about have now been picked up by other organizations and run with, things like how detrimental slippery floors are, repetitive strains, jumping out of the car, throwing balls, how detrimental these activities can be to dogs. So we've brought we try and look at the whole dog's physical life and assess that, as well as looking at, we're not behaviorists, but looking at the behavioral sides, because some behavior is also physical too, isn't it? So we look at how dogs have a poo, have a pee, their posture that they take for doing that, because that gives us insights into how they perceive their body. And other different behaviors, down to licking and chewing their body, and anal gland issues and gut issues. We're not nutritionists, but we see the connections with that. So we try and get a whole picture of a dog, which, along with, as I said, the posture, which is so important, we've got a really good idea of where that dog's primary discomfort / pain may be originating. It may not be the original part or the start of the story, because we treat chronic pain. We don't treat the acute cases. It's the chronic ongoing cases, and of course they're incredibly common.
So you discussed, and you were saying about giving the animal choice. And I'm so interested to talk about this because, you know, looking at my background, coming from the veterinary side of things, I mean, I was first a vet nurse, then I did veterinary.
Right.
And as a vet nurse, you know, one of our main roles is to hold animals while vets do procedures. And, you know, you are either really good at pinning that dog or cat down. You are like, no, she's good with holding the cats. But, you know, thinking back to the days, and, you know, I worked for probably about 5 years in veterinary practice. And throughout my years of studying as a vet, I practiced as a vet nurse in the holidays. Right. And I can't remember one time where we gave an animal choice to do treatments, you know. So it was very much, you know, we had a job to do. Yeah. And we pinned
limited time too.
Yes.
Your time scales are very different.
Yeah, we didn't have time. Yeah. So we just literally pinned the dog down, and you held that dog so that nobody got bitten, you didn't get bitten, and you held the leg out if they had to draw blood or whatever it may be. But I must say, if I think about it now, I was known as, when in veterinary nursing, and even in veterinary, you know, I would often get the vet nurse to do the drawing of the blood, because vet nurses are very good at drawing blood. And I would actually hold the cats, and we would draw from the jugular. And I must say, I used to have a way with cats. I never owned a cat my whole life. Right. Did we ever have cats when I was younger? But I was known at practices, even when I locumed, like, she is good with cats. And people used to say,
Right.
oh, gosh, but it was just because I never pinned them down, because I realized
Oh,
cats do not like being pinned down. They
no,
don't like
no.
being stand still, let me examine you. So I sort of examined them as they were moving, you know. So I let
Right.
them, and then I would
Yeah.
sort of stroke them and then look at them on the move. And I would do the same when we drew the blood. I would sort of just, you know, have them and then hold their head up gently.
Yeah.
And
Yeah.
you know, when I had to hold them, I would hold them, but I wouldn't be like stretching the cat so
No,
you know, for a
no.
long time. I did it, and we did it quickly. But it's so different from when I qualified as a veterinary rehabilitation therapist, where suddenly, you know, I realized, well, pinning this dog down and doing my treatments is not beneficial at all, you know. And you realize it, and you have the time, like you say, you know,
Yeah.
you've got time, and you need to build a relationship with that animal in order
Yeah.
to be able to treat it.
Yeah.
And the space has to be one where the energy is calm
Yeah.
and not this frantic panicking and
Yeah, that too. Yeah.
whatever.
Yeah.
And so things really, really changed for me. And only actually in this chatting with you earlier before we started, did I actually sort of compartmentalize how I changed. You know,
Yes.
it was
Yeah.
it wasn't a conscious thing. It was just, obviously for me,
It
it
was
just
an
felt,
intuitive thing.
yes,
You
it
just
just felt
something.
better.
Yeah. Yeah.
Just,
The empathy.
you know,
Yeah.
and I remember, you know, clients coming for certain treatments. You know, they'll come for acupuncture, and the animal wouldn't do well. You know, I would do the acupuncture, and they were just uncomfortable and just snapping at me and trying to bite
Yeah.
me. And then
Yeah.
I would say, okay, let's try something else. You know, and
Yeah.
they'll be like,
Yeah.
no, 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 but I'm coming for the acupuncture. And you know, I had a very similar situation actually with my husband, because my husband's dog I treated years and years and years ago with acupuncture and underwater treadmill, and I did biopuncture injections, and his dog Roma, she responded to everything and she loved all the treatments. And now we have a very similar dog now. She actually looks very similar to Roma. So she's like a German Shepherd cross Labrador. She's 12 years old now, very arthritic, and doesn't want any of the treatments that I can give her. So when I acupuncture, she just tries to bite me. She just won't relax. I try and put her on a PMF mat. As soon as I switch it on, she's jumping up. She doesn't want it. And my husband was like, just pin her down. I know what you can do. You know, you can help her.
Yeah.
And that's not how we work, you
Not
know.
appropriate.
She
Yeah.
has to want the treatment, you know. She doesn't
Yeah.
want
Yeah.
it. We're actually doing more harm. But
Exactly.
funny enough, I actually have a colleague of mine who's a veterinary physiotherapist who comes weekly to treat her. And that she allows, you know,
Sometimes, yeah, sometimes we have to disassociate because treating your own animal is so difficult, isn't it? Yeah.
So she lets Shanae treat her, and I'm fine with that. Like, I just want her to get treated. So yeah, let's chat about, you know, what it actually means to give an animal choice and when treated.
Absolutely. But of course, I mean, you touched on so many points there, and the veterinary world obviously is very different to the therapeutic world, but also in a veterinary situation, there are things that you have to do, like, you know, stick needles in for injection, which you're not going to go, oh yeah, I really need an injection. But as a therapist, we're tapping into the dog's intrinsic knowledge of knowing what treatment they need, and that's where it really is different. But of course, you're talking about cooperative care in veterinary work, which is amazing. But with us, we use something that we've called Positive Pact, and it's a very clear protocol, and it's almost like, and I've talked all around the world, and people love to ask me, oh, can you just do a demonstration? I'm going, oh goodness, really? And the dogs, it's like they've read the manual. They know the manual in whatever country. And it's really interesting how they understand very quickly what we are trying to do. We're trying to work with them. So you mentioned the word relationship. It's all about that relationship, that trust relationship. So sometimes on the first visit, we may not do very much, but we have done a huge amount as far as establishing the boundaries, I suppose. That sounds quite harsh, but the boundaries that if you don't want me to touch you, then I won't. But if you come on this area, which is very clearly signposted, either it's a a blanket, a bed, whatever it might be, because we only ever treat on the ground or just off the ground. If you come here, that means that we are going to, with good intention, put our hands on you. And it's so interesting how quickly they get to know the exact rules involved in that. And probably our biggest challenge within the whole choice side of it, establishing this, are the guardians, because they think their dogs are being naughty if they're not going in the area. They want to tell them to sit, stay, lie down, or no, that's lovely. You're a vital part of this, because your dog needs to know that what the choices they're making are good, but just let them make their own choices. So it's establishing that real relationship between everyone. But as I said, the dogs, they get to know so clearly that sometimes if they only want their front end treated, they'll only put their front end on the area, on the treatment area, or their back end, or one leg. That's how very clearly they understand what we are looking to do. So that's one very small part of it. The big part is the freedom of movement for them. So they may come onto the area and go, wow, this is good. And then you put your hands on with good intention. As a therapist, you've always got to remember to breathe, because the moment they actually come and sit near you, if you suddenly put your hands on, and they go, oh, what? You have to take that breath. And once you've taken that breath, the dog may leave, and that's okay. But then they'll come back again. And then you put your hand or hands on. And because we've done the postural assessment first, we've got a good idea of where a dog may be most uncomfortable. So we would never, ever touch them on an area that if we feel uncomfortable or they're avoiding. So we put our hands on. Now, we may just do a few seconds of manipulation. And then they go, oh, no, that's enough. And they walk away. It's fine. So we sit back and we go, OK, that's fine. Because we give them thinking time. And we all need thinking time. And I don't think as people we give ourselves enough thinking time, but they need that thinking time. So we don't immediately go, come on, then come back. We always actively encourage. We never use treats. We actively encourage, so we give our nice open body language. But sometimes they just need to think. So they can be walking around and they can sniff. They do a very different sniff to if they are sniffing something. It's a different head action. It's not that deep, I'm sniffing whatever's here. It's slightly above the ground, and it's that thinking sniff. And then they may just stop, and you as a therapist might think, oh, I'm not sure if they're going to come back, but let's just sit here. And then they'll go, if I go there and it's not good, I can leave. Let's give it another go. So they go on, and this is how it sort of progresses. And the lovely thing is that every now and then they'll look up at the guardian, and the guardian's sort of got to be in the room, but not actively involved. And they need to give that eye contact or whatever it might be of, yeah, absolutely. And then they go, okay. As long as they know that their family is happy with this, then they have more active free thoughts. And of course, then we are treating a dog that wants to be treated because they know what we're going to do, because we have shown them, and they're relaxed, and they're in a much better frame of mind. Their muscles are relaxed, the fascia's relaxed, everything's relaxed. But what we're doing, and the moment we do put our hands on, we're watching every flicker of every hair of the ear, the eyebrows, whatever it might be. Because if they go, suddenly, that's not good, we stop, we go, are you okay with this? And they almost change their breathing sometimes. And then they go, yeah, okay, keep going. So then we can keep going. But if they go, no, no, it's okay, off you go. And they have to think about it a bit more, and then they come back. And it's the most, it's this it's choreography almost, but it's improv as well. It's just, we don't know what's going to happen, but we all work together, and it's the dog's rhythm. And every rhythm is different. Some dogs get it immediately. And my theory is that some of the dogs that get it very quickly are dogs that are used to having their own thoughts. And some dogs that don't are sometimes dogs that aren't used to being given that opportunity. Not always. But sometimes also when you're halfway through a treatment, they have to go and see what this new leg feels like. And you actually see them almost trying on their new leg. And, well, that feels okay. That feels good. Yeah, okay. And another stage of it is when they have not wanted you to touch generally the lumbar pelvic region. I mean, that's quite often the most sensitive, isn't it, in most cases. And they will hide that from you and ask you not to go there. And then they may come back, breathe, get off, come back, go, and go again, and then come back, and then lie down and give you that area. Just there it is. And obviously you've got to be very careful, because you don't want to then belay their trust. So you've got to then treat and go, are you okay with this? Are you okay with this? And it can be verbalized, not always. And it's the most amazing thing how they present that to you. As I said, sometimes it can happen in the first treatment, but with some of the reactive dogs we see, because we do see dogs that obviously can be in a lot of discomfort and pain, that maybe don't like touch. Obviously the vet is the first. We always ask for dogs to go and have a pain assessment first. That's really important. But once they've been referred or given consent for us to treat, then we have to build that trust for them to relax, for us to be able to touch them. And I know a lot of therapists treat dogs with a bit of a bite history too. And they too, because they've got the choice, can leave when they feel they can't cope anymore. And that's a wonderful experience for them as well. So there's a lot to it. I've spoken a lot, haven't I? I did breathe in between all that.
How does that look? We've obviously been talking a lot about dogs now.
Yeah.
How does it look differently when you're treating cats?
I don't really treat. I have treated cats, but it's something that we haven't trained in. I haven't trained anyone in, but I have. Cats are extraordinary. Cats are so different. I've treated 2 or 3, and it's definitely on their terms. But what I can't believe is when they get it, and which can be quite quick in the whole process, they repair so quickly. It is incredible how quickly they repair. But no, we're very specialist in the canine.
Okay. Yeah, I mean, as you were talking, I was thinking maybe it's because I'm the cat lady, but like cats used to always come and put whatever area, even when I was a vet, they would come and show me, like, this is where the problem is.
Yeah.
And they're so intuitive, cats. They just know so much, and I think
it's scary, really, isn't it?
It is, yeah. And I used to have this cat, who was a Siamese cat that was so cute. It loved its treatments, but its favorite was actually sitting on a pulse electromagnetic field therapy mat. It absolutely loved it. And the owner and I used to take lots of joy at playing tricks on the cat and laughing. Because we would put it on and the cat would purr and purr and purr and purr. And then secretly, without it seeing, I would switch it off. And then it would look at me, like, what are you doing? And then I'd put it back on and it would purr and purr and purr. It was really cute, yeah. And I used to say to the owner, well, at least we know the mat's working,
Exactly, exactly. And whatever it is, it's the right thing for that cat at that moment. Absolutely.
Yeah, he used to absolutely love it, yeah. So, I mean, if you look at, the way in which you're treating and you're obviously giving them choice, you know, obviously there was a time where you weren't, you know, in the beginning. I
Yeah,
mean,
yeah,
so like if you had to describe like the difference in
yeah,
your treatments now compared to then and what you've learned,
yeah.
um, yeah, could you go through that for us?
Yeah, yeah. I mean, it was a long time ago, but I will try and relate back to, because these things evolve, don't they? And I think one thing is that I'm good at observing, and I'm good at working with whoever I'm working with, being a canine. So before, perhaps if a dog moved, I used to go to where they had moved and say, "Come on, should we try here?" And then they'd move again. I said, "Well, can we try here?" I've never ever pinned a dog down in a treatment ever, and I know that there are some organizations that do advocate that, but I never have. So I haven't ever done that, but I have followed them around, and I haven't given them the space to think or given them clear direction as to where I will be. So that was something. And then I realized that, and it didn't take very long, but it took me a long time to realize that there was a pattern. And I think that's the big thing. It was the pattern that was the real wow, yes. And the sniffing I didn't recognize as thinking sniffing, and the going round and then coming on and going off, the flyby we call it. I didn't recognize that. I thought it was, no, they don't want it. No, they're thinking. So there's a lot that I've pieced together to form this whole now protocol, I suppose. But yeah, before I did used to go with them around the room, and typically it was a couple of dogs that I saw regularly that taught me to actually, just leave me. I'll come back. I know you. And I started to watch them, and maybe I got to know the guardians quite well. So we were having a chat and sort of ignoring the dog a little bit, then noticed that the dog came back. And I remember being quite surprised. As I said, this is years ago, going, oh, oh. And then it takes a few, doesn't it, before you think this could be happening to other dogs too. And of course, then you may have a dog that never came back, because all dogs are different. You think, oh, maybe not. And then the pattern starts again. So again, there are always anomalies, but generally, that's how most dogs behave when we do it. So that, I suppose, is the history. So it's difficult to remember when you've been doing something for so long. But yeah, it's a good question, because that's what I used to do. I used to follow them or actively encourage them. And I also used to use treats. That was the other thing. Or the guardians used to use treats, which, and I get it that some need that distraction, but actually the distraction we found can be also quite dangerous, because if they're focused on licking something from a tube, and I'm not saying it's wrong, it's just for us, we don't do it, or we most certainly try not to do it. It's very, very rare. But they can be more focused on that than if you hit an area, because we work pretty deeply in this tissue, very deeply, that suddenly they haven't been focusing on that intensity change. Suddenly they realize, and they can obviously go, what are you doing? So we like them to be able to be fully in touch with what's happening on their own body. Then they can make choices much quicker than if they're being distracted. So yeah, I did use treats and move around the room. Good question. God, that's really going back in my mind.
Let's chat about that dog that chooses the no, and how you handle that, because
Yeah,
you know that guardian has come in and
yeah,
they're wanting something for their
yeah,
dog, you know, and they're
absolutely.
pretty adamant about it.
Yeah,
And that's always a difficult situation, you know, similar
very.
to me and my husband, you know.
Yeah,
Um, is how you handle that. And,
Yeah.
and they're there and they're paying for their hours treatment or
Yeah.
whatever the length of time. And
Absolutely.
you can see the guardian is sitting there saying, she's not doing anything.
Yep.
Like, what am I paying for here? And like looking at her watch and
Exactly.
thinking,
Exactly.
yeah, give us some advice on how you handle those kind of
Sure.
situations.
Well, firstly, now, because we're known for it, people actively choose us for this. And because our therapies have amazing effects. So they do choose. So a lot of people are aware of how we work. However, you're absolutely right. People want their dogs to be treated. That's why they come. And also, they're paying us. So we manage that way up front. So when people book, we say, this is what we do. This is our treatment protocol. It may be that in the first session, we may not even put our hands on your dog to treat them, but it's about building a relationship. So at that point, if they think, oh, I'm not sure about this, then they don't continue. And we make it very, very explicit that that may happen. But the thing is, by making it explicit, when people arrive, if you put your hands on for 5 or 10 minutes the first time, people go, wow, I wasn't expecting that. No one's been able to touch this dog. So the pressure's off. You're churning that stress levels down of not just the therapist, because of course we feel under huge pressure to make a change in a dog's life, but also to be able to help the guardian too, because their life's being affected by how bad their dog is. So we want to have that positive change. So by turning that expectation level right down, it doesn't put anything on the dog, it doesn't put anything on the therapist, and the guardian is absolutely clear. So we don't just sit in a room, and this is where sometimes choice can be given a not a bad name, but just not given the real sort of way that it actually works. It's not, we don't just sit there going, oh, come to us if you like. We actively encourage a dog and show them and use proper body language, appropriate body language. We're very, very aware of that and very, very calm about the whole thing. It's not just you walk in a room and go, oh, well, they don't want a treatment. That's not, dogs are very clever and they know about intention, and we have to show positive intention. So even if a dog does not want to come and sit with us, we have to show that positive intention all the time. Sometimes if the dog really looks like they're more worried than they want to have the treatment, but they need a little bit more comfort, I ask the guardian to come and sit with me. So they're at my level. So we sit all together and they don't actively do anything, but they're there. So sometimes that is helpful. But we try not to do that because it then restricts a dog from really being able to stretch out and move. But we need to make these dogs feel better and to help them. So that's what I may do if we really are not getting anywhere. But that could be second session. And quite often, we don't need to go that far because the first session, it can be limited. The second session, we can do a really good treatment, but there could be a lot of moving. The third session, they more often than not just bound in if they come to us or we go to them and they go, yay! And it really is that dramatic. So hopefully that explains that thing, but it really is about managing expectations.
Yeah, I mean, there are times that I think when I've treated animals and they've been better without the owners in the room. You know, you just have some patients that are like that. The owners particularly stressed or, you know, on their phone all the time and, you know, and then, you know, we have those.
An absolute no-go. No, they can look on their phone, they can, but we say to them, can you be in the room but not in the room? So sometimes I just ask them to look at the ceiling until the dog settles, and then they might be able to, it'd be nice if they can be involved emotionally in it. Yeah, but we always have the guardians in the room with us, always. Yeah.
I just also wanted to touch on, the veterinary side of things. You say, obviously, I gave my example of just my memories. It wasn't always just pinning down, but like you said, it was to do procedures that needed to be done.
Absolutely.
But in the veterinary world, there is a big movement now, like fear-free, and I think you chatted about one called cooperative care. There is this big movement in veterinary to be able to give them some choice with certain things, and for example, I've seen some amazing videos of drawing blood from animals where they literally are not pinned down. So I just wanted to bring that to the listeners' attention, that veterinary is not all about, there is a big
no. It's a wonderful movement,
years and years ago, but we have evolved in veterinary too, and we are changing our ways and realizing, we can't just be pinning animals down all the time. And there is situations, not all, there are situations where we can give them choice, and we can do it in a fear-free way that is not us pinning them down.
We're working at the moment. I think I mentioned before that I went to talk in Brazil to predominantly a group. It was a live seminar of veterinary behaviorists and also dog trainers. And of course, that's a wonderful combination, especially when you're looking at cooperative care, for trainers to be able to help the clients with their dogs. So when they go to the vets, they have these skills to be able to help the vet. It's a win-win-win-win-win situation. And so it was lovely to be in this audience with people. So you're absolutely right. There's this fantastic movement of change, because we all want the same thing. We want the animals to improve. And of course, with our knowledge improving and changing, then it gives us the advantage to be able to do that.
You mentioned your positive pact. I don't know if you call it pact or PACT.
Pact, positive pact.
Won't you just summarize that a little bit, and then just let the listeners know if they want to learn more about this, where can they find more information?
Yeah, sure. Well, positive pact, I'm going to have to read off the screen slightly because I want to get it right. Is positive, progressive, effective cycle of therapy. That's what it stands for. And it really is. It's about the relationship. But it's also about recognizing that dogs are sentient beings. That's obviously the big thing. Giving them the choice. That's what we've discussed. And this is how we've sort of set it out in our paper. Freedom of movement. That's another thing that obviously I've talked about a lot. And then the progressive therapeutic relationship. And that's a three-way thing. That's between therapist, dog, and also guardian. And that's how we work. So it's those main components, but the other one is treatment empowerment, and that is empowering the dogs to be able to be sort of in charge of their own bodies and their own treatment, because they're the ones that know where it hurts and where it doesn't, and what's going to feel good and what doesn't. So it's the treatment empowerment that really comes from those facets. So that's sort of where it all fits together, I suppose.
And where could somebody go to learn more about this?
Well, as a Galen Myotherapist, everyone is trained in positive pact, but also now we've just started a level 5 rehab course, accredited course, and anyone outside of Galen Myotherapy that wants to do the level 5 rehab with us will actually have to go through a sort of like an access course where they will learn about how to use positive pact, because positive pact is a massive part of our level 5. So that's one access for people that are already therapists. But we don't teach it in isolation, because it's part of the whole protocol with posture and our comfort scale and pain and behavior and everything else.
So, and your website is GalenMyotherapy.com.
GalenMyotherapy.com. It is indeed, yes.
Julia, it's been such an honor chatting to you and meeting you,
lovely.
and I love the conversations. Thank you so much for sharing your knowledge. It's been great.
Well, thank you very much for inviting me. Thank you.
Cheers. Thanks so much. Bye-bye. If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at pawprosper.com. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 8th of November, 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.